In evaluating a child with seizures, it is important to determine if the seizures are provoked or unprovoked. Provoked seizures, or acute symptomatic seizures, are due to an immediate or transient problem. Examples include meningoencephalitis or encephalitis, acute stroke or head trauma, electrolyte imbalance, or toxins, including alcohol or other substances. A history of injury to the brain months or years prior do not count, as they are not immediate or transient problems. To identify if a seizure is provoked, you must pay attention to the details of the clinical presentation, as the treatment is focused on treating the underlying disorder in addition to acute seizure management. Febrile seizures are important to distinguish from other provoked seizures, as they are more common, carry a more reassuring prognosis, and require less investigations. However, provoked seizures can also occur related to CNS infection in this age, and it is important to consider this in your evaluation. You need to be careful in evaluation to determine if the seizure in question is truly a febrile seizure. Febrile seizures must meet the following criteria: presence of fever in a child between 6 months and 6 years, absence of a central nervous system infection, no prior history of neonatal or unprovoked seizures, no prior diagnosis of epilepsy, and no significant neurologic impairment. Febrile seizures can be further classified as simple or complex. Simple febrile seizures are generalized, last less than 15 minutes, and do not recur within 24 hours. On the other hand, febrile seizures would be classified as complex if any of the following are present. The seizure is focal, lasts longer than 15 minutes, or recurs within 24 hours. Please note that while complex febrile seizures can be focal, you must always consider a brain lesion if the child has repeated focal febrile seizures affecting the same side of the body. It is important to counsel parents that febrile seizures may recur again. However, the risk of epilepsy is only very slightly higher than the general population.